One, go.
Okay, thank you. Good evening, everybody. This is Rob Lyons, chairperson for the East Bridgewater Board of Health, and I'm going to be conducting this meeting remotely. And before we officially open up the meeting, I wanted to just give reason for my absence and having to do this telephonically. Unfortunately, our household has a breakthrough case of COVID, and it's a close family member. I am showing some symptoms. I've been tested, but I have not gotten a test back. We are hoping for a positive test. Okay, I can see everybody on screen here. Obviously, we're hoping for a positive test, but in the interest of being safe and under guidelines that we all need to follow, I'm conducting this meeting remotely. So I apologize for that, but with that said, I'd like to welcome everybody to Thursday, August 19th. And we're going to start by having a discussion centered around COVID-19 and masks in our school system and general guidelines for COVID as well here in town. So at this point in time, before we get to all the to each of the board members, are there any members that are present that would like to offer commentary? Now, keep in mind that I cannot see who's there.
No.
If there is, Matt, if you could recognize them
Sure.
and ask them to come forward and state their name and address.
Are you looking for members of the general public in front of us
Correct.
that would like to offer commentary on COVID-19?
Correct.
No one steps forward.
Okay. All right.
Oh, wait, yes.
So,
Oh, hold on. Yet. Yet.
Okay. So that individual needs to step forward to and clearly state their name and address.
There's no one
There's no one to
stepping
step
forward
forward
at this time.
at this time. That's probably a better way to say it.
Okay. So it's safe to move on?
Yes.
Apparently so.
Okay. So at this time, I'd like to have the board members have a discussion amongst ourselves as to where we are with COVID in town and any recommendations that we may have as individuals, board members that we would want to put forward. So before we start with each one of the board members, Sue, would you be able to give us a recap? And I'm sorry, is Heather with us as well?
Yes.
Yes.
Okay, all right, thank you, Heather. Yeah, Sue, would you mind giving us a quick recap of where we are?
Sure, yep. I sent out an email to the members, I think, earlier today. Since August 1st, so we're at August 19th now, we've had 58 confirmed cases. We've had 1 confirmed death, correct? At this point today, I think we're up to about 5 hospitalizations. And of those cases, last I checked this morning, I believe 14 of those cases were under the age of 18, so school-age children. And the vast majority, maybe all but 2 or 3, were symptomatic, we could say. And, you know, it seems to be definitely a little bit more contagious through households than it had been previously. And Heather Doucette, our public health nurse, is here, and she has been doing a majority of the contact tracing now that she's on board with us. So I'd probably defer to her for a little bit more insight on what she's been seeing when she talks to people.
Sure, I can definitely speak to that. I have seen, obviously, an increase of cases over the last month or so. Definitely significant amounts of breakthrough cases. I don't have solid data because, unfortunately, we're still gathering everything as we go, but I can certainly tell you that I have my finger on the pulse of the community, and without a doubt, people are more sick this time around than they were previously. The virus seems to be more contagious, and by that I mean, for example, we used to have maybe 1 or 2 members of a household be positive for COVID, and now it definitely seems to run through the entire home. Typically in the past, I had seen quite a few people who were asymptomatic, or spoken to quite a few people who were asymptomatic, and that is not the case right now by any means. And, increased hospitalizations, one unfortunate death, a couple people that were significantly ill. So I think that, unfortunately, I wish I had the pleasure of sitting here and saying that things were going in a positive direction. However, I can tell you firsthand that they are not.
Okay, thank you, Heather. So at this time, oh boy, there is a delay. There's a little bit of delay in the video and in the audio, but regardless, at this point in time, I'm going to open this up to the board members for discussion on any or any guidance that the board members feel that we should be offering to not only the school systems but also here in town. So Matt or Lisa, do you have anything to add or input or?
Other than what's coming from the state and DESE?
Correct.
No, I'm pretty comfortable after reading through the DESE guidelines for the school and the mask mandate for the school to go with that direction. And as far as the state guidelines, I think they'll pretty much steer the ship if they feel we need to take a different turn. It seems like our numbers are pretty relative and comparable to the neighboring towns. So at this point, I'm comfortable with what they have in place for now. Matt?
Okay.
I personally think that the DESE recommendations are weak and leave us open to similar to what happened last year in this town where we had a rash of cases. And I would like to see a stronger recommendation from the Board of Health. But it is a board of 3, so we get to make a decision as a group.
Sure. And Matt, so looking at a stronger recommendation, do you have any specifics that you'd like to add?
Yeah, I'd like to extend the mask mandate through K through 12, as opposed to just K through 6.
Okay.
To vaccinated and unvaccinated people. We currently have a positivity rate of 6.5% in our town, and
Mm-hmm.
the American Pediatric Academy, the CDC both agree that masks throughout the all age ranges are appropriate, and they're just not making it mandated. They're suggesting it. I don't see why we wouldn't follow CDC guidelines, but.
Okay, so we're kind of looking at a three-tiered, I'm going to use the term opportunity, where we have K through 6, grades K through 6, 7 through 12. 7 through 12, and correct me if I'm wrong, I think we have over 900 plus students in our school system that have been vaccinated. Mm-hmm. And then we also have the adult school community, teachers, administration, and support staff. So, Matt, your recommendation would be that all individuals that are not just students K through 12, but all individuals that are in the school building would be mask required.
I would make that as a suggestion, yes.
Okay.
You've shown that
Now,
the Delta variation does not care about whether or not you're vaccinated or not, and it doesn't stop the spread. We're
Mm-hmm.
looking at one right now. It's, I don't know how we can close our eyes to that and pretend it's not going on. But again, we're a board of 3.
So, is there any other input that either of you would like to add to the conversation? Okay. So what I'd like to do is ask for a vote 3 times. Once for K through 12. Once for K through 6, once for 7 through 12, and then once for adults in the school system and the school building.
Excuse me.
Yeah, hold on, we have a question from
Wait,
Steve.
just a
So-
question.
Yeah, and just to clarify, I believe, is it the school committee that has the final say with their vote? We can recommend, but we
Yeah.
can't implement?
And-
So I just wanted to, I don't know if it's appropriate or not, but, and I don't know, I know the school committee hasn't met yet, but are you able to tell the board what your proposal is for a mask policy for the schools, just so the public knows what you're thinking about, or is it too early because you haven't met
The
yet?
school committee meets August 24th at 6:30. And right now, we currently have a mask policy, K through 12 at the district,
Okay.
that we did not rescind last June, so it would still take in effect if they continue to do that. We have spoken to our attorneys, we've spoken to the Department of Education this week, and there was language going back and forth about our policy today between the attorneys and the school committee chair at this time putting it together. But I do want to say that, you know, surrounding towns and us, we try to stick together and we try to do what is the most safe and healthy way that we can move forward with the school district. I cannot speak for the school committee. I'm the liaison between the schools and the school committee. Like I said, we have that school mask policy in place at this time, which was MASC, I think it was ABDCF policy from last year. Whether they rescind and come out with a new policy, whether they amend the policy that they have, or whether they keep the policy that's going forward, that's yet to be seen. The recommendation from DESI and the DPH is pre-K through, for us, it would be pre-K through 6th, wear masks, and then 7 through 12 would be optional, and that was because kids can get vaccinated. We've talked to Chief Herron about bringing a vaccination ban, and you, Sue, I mentioned that I spoke to the chief. Once the school committee makes their decision, I'm gonna bring in the vaccination ban anyways on the 24th, the 26th. We have sports starting that week. They have other kids that might not have been vaccinated, and we're opening up to the community. I told Chief Herron, I just wanted to wait for the school district to, or for the school committee to recommend their policy, to adopt it, and then I'll send it right out that night. The vaccination van will be there either way on the 26th, but it's just, we were just holding back on it a little bit.
Yeah.
But the recommendations, and I don't want to speak out of turn, but Whitman Hanson took their vote last night. They're going to go with DESI regulations. Speak to West Bridgewater Superintendent, that's his recommendation going forward. Carver met, I think, last week or Monday night, or this week, Monday or Tuesday night of this week. They're going forward with DESI regulations. So many of our neighboring communities are going with the DESI guidelines at this time.
And currently, MIAA has their own set of guidelines, which obviously each school district can tweak, but their quarantine and mask mandates are pretty much comparable to DESI. I think, speaking as a parent, there's a lot of parents who are scrambling to get their kids a vaccine because as the conditioning and things like that started in the school, they encourage the kids to be vaccinated in order to participate, and as far as exposure and quarantine guidelines go. So I think if we go against or stricter than DESI, we're going to get a lot of parents that just won't bother to vaccinate because they're vaccinating for a purpose and not necessarily because they wanted to vaccinate their kids from the get-go.
Lisa, can I
Yeah.
just, MIA just is switching over executive directors. Bob Baldwin will be taking over, he's former superintendent of schools. He'll be taking over, well, just has taken over. He'll be following, I can guarantee he's gonna follow an ASS. He will come and he will go with, what you're seeing right now, so.
Yeah.
Can I just ask a follow-up question to that?
Yep,
Sorry.
yeah, Lisa,
Um,
Susan asked a follow-up question.
So the DESI guidance is guidance, so do you think the school will do a policy for pre-K through 6, or do you think it will just be a recommendation to parents?
I think that the school committee will put a policy in place. I think we used the Massachusetts School Committee's MASC policy last year.
Okay.
I believe, and the commissioner came out and said, you know, we're going back to school 5 days a week. We're going back in person. There is no remote learning. That is, he is adamant at that. He's sticking to that. I was on the phone last week with my colleagues. He is absolutely sticking with that at this time. We did a great job, many schools did, but I can only speak for East Bridgewater. We did a great job of the mitigation, we did a great job of doing what we do well in East Bridgewater. We followed the guidelines. When it came springtime, we had everybody in. We didn't have a lot of transmission, with no transmissions within the schools, so we did a great job with that. I think the teachers understand where we're at. The desks are back, but we don't have any less than 3 feet. Physical education, and the guidelines are saying they can take their masks off outside. I've been here all summer long, I can tell you, we've had extended school year, we've had Little Vikings and before and after care, and we were mask optional. I can tell you we had no cases inside of our programming. That
Can I
were brought
follow-
to my attention or at
We had no cases in school last year. What were the mask guidelines last year in the school?
we said, we took the MASC policy,
Mhm.
and everybody wore a mask.
Everyone, so there was
And
no
then-
transmission with masks in school?
Yeah, and then at the last school committee meeting,
Oh, yeah,
we said masks were
I
optional.
just wanted to make sure it was clear that we had no transmission in school last year, but we
No.
also had masks in school last year.
And we haven't
Agreed.
had any transmission since June when it's been mask optional.
And we haven't had any transmissions in June when it's been mask optional, but what have our cases been across the town since June? So,
Nothing in
June
June.
and
so
July
it's-
were
yeah,
quiet.
End of July till now.
so
yeah.
July till now, there were no cases in town to begin with, but now we're looking at 50 cases in the last 18 days.
If the school committee tells me
Yeah, I
everybody's
know.
gonna wear masks, we're
Yep.
gonna wear masks.
Yeah, I'm just trying to get all the information out there, since this is what we're doing is.
Sure, I just came tonight to listen to your recommendations, so I can bring them back to Mr. McLaughlin, and let him tell his school committee. I think it would be 50-50. I think I'm gonna have some parents that are gonna say to me, you told us to get vaccinated, you told us it was gonna be optional, and now you're rescinding on that.
And
I'm looking at safety as well as you are. We know that we were told by the American Pediatrics doctor on the phone, maybe in July it was.
Mhm.
He's out, and he lives, I think, in Brookline, Mass. So we hear from him.
Yeah.
And he talks from the commissioners or from the governor's office. He did say, mass transmission from the smaller, for ages 12 and under, wearing a mask, we're not removing them from school.
Yeah.
That was one of his, and I think they're staying with that till now. I haven't heard from him going into this year yet. That was probably right at the end of June, beginning of July, our last meeting with the commissioner for a month.
Yep.
And then when we went to our meeting in July, the commissioner was just adamant, we were going back 5 days
Oh,
in
yeah.
person, no remote.
what's the plan in case a student does contract COVID, as far as no remote, just personal curiosity?
Well, we've got, we have a test and stay protocol now from DESI, where we would test the student. They would stay in school because we would,
I think he means for the
No,
positive child.
Positive
has to be out
child,
10
positive
days.
case.
they, as of right now, those protocols may be changing. So I can't talk to that because the school committee will hear them on Tuesday.
Okay.
We are working on them. Karen Clifford, our COVID point person, is working with DESI, has been working with Sue. We met with Sue, was it Monday, Sue?
Yep.
We talked about those. If a student goes home, it'll be as if they were sick, and they will get their homework, and they will have to, we'll go back and forth, but there will be no virtual or remote.
Yeah.
So, I mean, that's what I'm taking,
Oh, yeah.
at the two bosses.
Yeah, no, I understand. I was just curious, because I wasn't sure what would happen, knowing there was no virtual school.
Yeah, because there is no virtual, so now that the child would be sick. Last year, we had students at the end where the child was removed that may have had symptoms or had come in and had symptoms, and we went back 48 hours. Okay, they sat at a desk with somebody. That student was monitored, and was it the next morning, they would come back in, take the temperature. If they had no temperature, they went back in the class. And that was the protocol we followed. And we were still in masks,
Yeah,
so.
again, still, I guess.
So I mean, I can't tell you exactly because we're not there yet, but I would think that we would do what we did before. We've got a lot more people in place this year. We've got our wraparound services, I think, are going to be better, of how we're dealing with some things. I think we learned a lot
Yeah.
last year, how to contact kids and.
I have a
how to
kid
get back to their
in two
homes.
schools, and like I say, I was very impressed with you guys handling it. I thought it was fantastic.
Thank you.
Both of my kids got the education they needed. It was amazing. I was very impressed, so.
But I think we're, if kids were to have to stay home, I know we've got a better handle on how to get work to them, how to talk to parents, a little bit easier. We do have a new system that's gonna come in, it's gonna make it easier for teachers to talk to parents through not just Google, but another, it's called Parent Square.
Yeah.
So we're working on that right now, and the teachers will get a handle on that next week. We'll come back.
Rob, you have something?
Okay, Superintendent, thank you for that input. Does anybody else on the board have any other comments or anything they'd like to add?
I just had one quick question, Liz.
Yeah,
With the
but-
CARES Act, is that all that money depleted for COVID stuff? I'm
For
just
the-
wondering with the possibility of being able to buy next a kid who may have been susceptible, can
Oh,
they
they
buy
do.
next at the school nurse?
We
Happening
still-
every day.
Oh, they are?
Yeah.
Okay.
We still have tests. We still have plenty of tests
And I think,
left.
think we're getting a lot more
And we're
with the
getting
new
more.
company, right?
Yeah, and we're getting more from the company. And we were just told that there's another test that's coming out that the schools will get, like we did the Binex. And we were one of the first schools that signed up for the program, so we got we got it free.
Great.
Sue, we talked briefly about with Superintendent Legault about other towns and what they were doing with following DESI guidelines. Do we know what those other towns' COVID numbers are?
It was sent in an email, did you?
I sent it in the email to you guys yesterday, the surrounding.
The surrounding towns?
Surrounding towns, yeah.
Okay. You must not have seen it. I'll have to look
That's
at
what I
it.
was just looking at.
Yeah, we're somewhat similar to Abington, Whitman, Carver.
Yeah, I mean, we talked to some of our fellow community contact tracers, and everyone's busy. The state actually is so busy with contact tracing, they send stuff back to us that they couldn't handle, so.
Oh, there you go. Thank you. Okay,
Rob?
Rob?
Okay, so at this point in time, I think if there's no other comments other than myself, and again, just kind of lean on what Matt said again. I think the schools did a great job. I did not have a child in school last year, but from everything that I've seen and folks that I've talked to, in the most difficult situation, it was a fantastic job. So thank you for that, Matt. So my position is that as difficult as this is, I personally think that it's going to be easier to take a stronger position starting out than trying to change midstream. And if we have to change midstream, then I think that's an indication that we might not have done something correctly. So I am leaning towards a complete mask requirement recommendation for the school committee. But what I'd also like to do is to set a 45-day timeline, or wherever that falls into a meeting around that time, we can look at the calendar and then reassess. If we have to adjust in an emergency session at the last minute to have everybody change, I think it's going to be more difficult than starting out the school year with everybody knowing full well what the rules are. So with that being said, if there's no other comments, I'd like to have 3 different votes. One that would be K through 6, I apologize, K through 6 masks in school buildings. 7 through 12 masks in school buildings. And then adult teachers, support staff, and administrators in school buildings.
Sue has something.
So,
I'm sorry,
I'm
Rob.
sorry?
Rob, you're voting to simply make a recommendation, correct?
correct.
Okay.
At this point, it is a recommendation, correct? Unless anybody wishes to move a full motion forward.
Do you
that's
want
different.
a motion for each, or do you want a motion to do all 3?
I think if we do each individually, I think that will give us a recommendation at the end.
Okay, I'll make a motion that we take a vote on recommending masks for K through 6 students in all East Bridgewater public schools to the school,
Pre-K through 6.
pre-K through 6, thank you, pre-K through 6, to all public schools in the East Bridgewater School District, to the school committee.
Do I have a second?
Are we voting, or what are we? I'm
Voting to make a
confused.
recommendation.
Yes.
All right, so I'm opposed. I'm confident with whatever DESI comes out with and the school committee decides to go forth with.
Okay, so I'm going to make the second. Any further discussions? All in favor, say aye.
Aye.
Aye. All opposed, say nay.
Okay.
I'm hearing no
There was one nay.
There was one.
no
nay.
objection.
There was one objection.
Oh, one nay, I apologize.
That's
Okay. So that motion passes 2-1. So I am going to make a motion on the 7 through 12, our masks in the school building. Do I have a second?
I will second it.
And I,
Matt seconds it.
Okay, so I motioned. Matt second.
and I am opposed.
Any
I
dis-
believe that it should be optional for those who have already gotten both vaccines.
Okay. Any other discussion? Hearing none. All in favor, say aye.
Aye.
Aye. All opposed, nay.
Nay.
Okay, so that's 2 in favor, 1 opposed. That motion carries. The third element would be, and again, I'll make the motion, that adult staff, teachers, administrators, and support staff mask in the school buildings. Do I have a second?
I will second it.
Okay, that's a second, Matt. Any discussion? Hearing none. All in favor, say aye.
Aye.
Aye. Opposed?
Nay.
Nay. That's 2 in favor, 1 opposed, so that motion carries. So I would also, again, on each one of these, I'd like to reevaluate it in 45 days. And again, right now, this is a recommendation to the school committee. At any point in time, if we feel that it needs to be changed on an emergency basis, but I think after a 45-day period, we can reevaluate and see where we are. So with that being said, I'd like to move on to the other action items on the agenda.
Oh, hold on. We have comment from the public forum.
My name is Tim.
Okay.
When you this is Jim Purcell, interim town administrator.
Okay, Jim.
Thank you, Mr. Chairman. Earlier, you asked if there were any comments, and my reply was not yet. And hearing the COVID discussion with respect to schools, I'd ask you, Mr. Chairman, if you've given any thought to public buildings, town hall, council, senior center, et cetera, and do you contemplate making any form of recommendations to the balance of the government?
We will, and let's see here. Right now, our focus for tonight was pretty much on the schools.
Oh, I get that.
Sue, is it possible?
Yeah.
Yeah, but Sue, is it possible that we can add that to Tuesday night's agenda?
Sure.
Then I'm satisfied on that. You know, I'll yield the floor and see you Tuesday. Thank you.
Okay, thanks, Jim. Okay, getting back to our action items. We have a disposal work permit. It's for 115 South Street. And Sue, that's the only permit we have?
Correct. So reviewed obviously by Mr. Bucher. And permit signed.
I'm
by-
sorry, I didn't hear.
Reviewed by Mr. Bucher and signed off by him after review.
Okay. Hey, but on here on the notes, it says additional plans
Oh,
may be
yeah,
added.
no additional
I
plans,
just-
no.
Okay, so do we have those additional plans?
No, there are no additional plans.
Okay, great. All right, thank you. I apologize for that. All right. So I'll entertain a motion to accept the disposal works permit for 115 South Street.
Motion?
Seconded?
Okay, motion Lisa, second Matt. Any discussions? Hearing none. All in favor, say aye.
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 Aye. Okay, that's unanimous and passes. Then we have minutes,
Yep, so
and
they were all emailed to all three of you if you got to sign them.
Yep.
Yep, July
yep.
12th.
So they're not on here, but Sue, could you read us the dates of those minutes? I do have them here, but
Yes, July 12th and August 2nd, 2021.
okay, thank you.
I make a motion to accept the minutes?
I will second that.
Okay, motion Lisa, second Matt. Any discussion? Hearing none. All in favor, say aye.
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 Aye. Okay, that passes unanimously. Excuse me. Installer permits. We have one installer permits, ATL Construction.
I provided the two board members that are here with copies of the paperwork.
Okay, thank you, Sue. A motion
Motion to accept?
to accept?
I will second that.
Okay, motion Lisa, second Matt. Any discussion? Hearing none. All in favor, say aye.
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 Aye. Okay, it passes unanimously. And then we just have one invoice from Crystal Rock.
Correct.
Motion to accept?
Okay,
Seconded?
okay, motion Lisa, second Matt. Any discussion? Hearing none. All in favor?
Aye.
Aye. Okay, unanimous. And then we have, is it just one loan that we have?
Yes, yep, I emailed you the information and the board members have it in front
Yep.
of them.
Okay. How are we going to handle this, me signing? I'm sorry, I didn't mean to interrupt the flow, but,
You don't, I only need a majority, so 2 signatures is fine.
okay, all right, good enough.
Sue, do you have any information on this loan other than what we already know?
Nope, just what's in front of
Okay,
you.
fantastic. So I will make a motion to accept it.
Second.
Motion Matt, second Lisa. Any discussion? None, all in favor?
Aye.
Say aye. Aye. I didn't hear everybody, I'm going to
Oh,
assume that was
sorry.
All
unanimous.
three. Aye.
Okay, so we have a food service permit for seated. I apologize. For Sweetie's Shaved Ice. Now, is this a cart in town or is this a cart that's going to be visiting us?
So this is, she's from Hanover. She strictly does shaved ice, so literally makes ice and flavors it. And she's going to be at our recreation department's event this weekend.
Okay,
So-
great.
And
Um,
the board does have copies of all her paperwork in front of them.
So is this just a one
So-
event, or is she going
No,
for
but
long
seasonal, so she
standing?
can
Okay.
have a seasonal permit, yeah.
Motion to accept?
And
Oops, sorry. Go ahead.
Motion, Lisa.
I will second it. Make it work.
Okay, any discussion? All in favor, say aye.
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 Aye. Okay, that passes unanimously. So while we're on the topic of this weekend's event, so any of the food trucks, we've got everything all covered off. There's anybody that's going to be there is permitted and has the right certification.
Yep, so the other 2 food trucks are regular East Bridgewater food trucks, Wicked Flavored, which is perfectly flavored cafe, and Fast Frank's? Flashback Frank's, our local hot dog food trucks. So they've both been inspected, and they've both been in town for a while. And then we have the shaved ice.
Can Heather still hear me?
She left.
Okay, all right. There's a delay in the video, and I just wanted to thank her again for coming out for our meeting tonight and help us with this process. So if you get this, Heather, thank you very much. Okay, so this weekend we're all covered off. Let's see. Sue, do you have any additional updates?
Just wanted a quick update on Harvard Street, the beaver situation. The abutter had been in several times in the last few weeks with the rising waters.
Yep.
Our local beaver specialist looked at what was going on out there. He couldn't offer anything better than what he had already done. He feels that if we trap the beavers, they will come back and build more dams, and that, he's come up with the best solution. Plymouth County Mosquito Control went out there for me, and they assessed the area. They treated the standing water for mosquitoes. They're going to keep an eye on it. The water has gone down. It appears that maybe all that heavy rain we had a week and a half ago might have breached the dam a little bit, but they did find some more dams upstream. So at the moment, the water's a little bit lower. It has been treated for mosquitoes. They're going to keep an eye on it, Plymouth County Mosquito Control, for the health and safety of that neighborhood, and they sprayed from that area of Harvard Street all the way down to Route 18 with the truck that they go around in. So, nobody's ever going to be completely happy that abuts that area, but, we've made some progress.
Okay.
I'm trying to think. It's been a little bit of a crazy couple days. I think that is,
how
in
about
the
that?
nursing home, we have this ongoing odor issue at the nursing home.
Yep.
Matt and I actually met out there with the abutters, and we had a phone conference with Bob Silva from Preservation Septic Services. They've come up with a solution. They're installing an air scrubber. They've installed a muffler to help with the noise. They started working on it this week. They've already noticed a decrease in the noise from the air scrubber with the muffler. The odor is already starting to subside, and they'll complete that project up by the end of next week.
Okay, great. Okay, thanks, Sue. With regards to the health agent position, I've identified, out of the folks that have applied, I've identified 3, and probably going to narrow it down to 2 candidates that I think we should have an interview with or a further discussion with. Lisa, you did not find any that were strong enough or had the potential to move forward.
Yeah.
And then Matt, I'm sorry, go ahead, please.
I sent my
apologize.
email to Rebecca as requested. I found 0 candidates that were qualified for the position as posted. I could expound on and tell you what we actually got for candidates. 3 of them had advanced degrees. 2 of them were above a bachelor's, and none of them have any experience beyond 1 candidate with 1 year as the assistant health agent in a town. And I found that none of them had the experience that we were requiring for the position.
Okay. So that brings up a two-track situation where one we had talked about. So again, I'd like to bring at least 2 of these folks in for further discussion. And I guess we'll have to get with Rebecca and find out what the process is. Is Jim still with us?
He is.
Yes.
Jim, do you mind just giving us a little bit of guidance on next steps on the interview process if we continue with a couple of candidates?
Mr. Chairman, I'm mindful that you're the appointing authority for the position. But that said, I got to look at some of the resumes, and I think I'm more closely aligned with Mr. Foster, having read those. But my personal opinion aside, if you're talking about process, and if your board wants to conduct interviews, I say you simply do that. There's nothing mystical about the process. Vet your candidates. If you have, if you're bringing in 2, I guess you're calling them finalists or something. So their names are subject to public disclosure. So you should know that. Right now, their names are protected because you haven't acted on shortening the list at all. So, so be cognizant of that as well. If I, go ahead.
So that's one track, and the other track was we've discussed the potential of reconfiguring the job itself as an administrative position versus a health agent. So the process on that, even if it does not come to fruition, I'd like to start that process, regardless of what the background or the legwork. I'd like to get that underway, so that if we do not identify a candidate, we're kind of moving in the same direction, and so we could depart in either direction at any point in time. So what would be the process to redefine that job?
Well, I think you have to do first things first, Mr. Chairman. The town of East Bridgewater has, on at least 2 occasions in the last few months, changed course in positions. One was with the town accountant position, and the other one escapes me right now, but it's very, very confusing to aspiring applicants. In the accountant, for example, 3 of the initial applicants for the town accountant position who backed out told me that the reason they backed out was that the town, subsequent to advertising and receiving applications for the town accountant position, advertised for a town finance director / town accountant. And one of the applicants, who was a really quality person, said, "I'm not going near it until you guys figure out who it is you want to be." Okay? I suggest you take that advice to heart in this matter of hiring a health agent. I think you're, finish this step first before you embark upon any other search for a changed position. I think let me say generally,
Good.
organizationally, the outsiders who are looking in at East Bridgewater right now, and it's not just the Board of Health with its recruitment for the health agent position. They have a view of us which is incorrect, but that that there's a bit of chaos I hear going on. That there's people are leaving the service of the town, and that we're having difficulty recruiting people. We have had some recruiting difficulties, but it's been exacerbated by changes in approach. I say you do this thing first. My personal hope. I didn't see Sue Malloy's resume there. I did see the job description, so I probably know why she did not apply for it with the job description that you have. But for my money, I really ought to think. I think that administrative position, if it results in or makes Sue Malloy a bona fide competitor for a permanent health agent's position, or whatever you want to call it, I'd certainly be in favor of that. We're looking at reconstituting the COVID committee. I think you call it reopening East
ED.
Bridgewater here. Things can happen very, very quickly. And I think you need to stabilize that position. I think Sue's the person for it. The institutional knowledge that she has and the COVID experience that she has, I think is invaluable. And but I get ahead of myself. Finish first things first. If you want to interview health board candidates, maybe someone's going to come in here and knock your socks off. I doubt it. But if you want to go through that process, do it. But please get to it quickly. We need permanence in your health board position. Just for our own sake and for the sake of other departments, town administrator candidates are asking about it, about us as well. So let's firm this thing up, please, and soon. It's been a lot of months, so let's get to it. Thank you, Mr. Chairman.
All right, so Jim, getting back to the operational element,
Yeah.
do we have a special meeting where all the board members interview the candidates?
Yes, you can do that. If they're, if you consider them to be finalists, their names have to be posted on your agenda.
Okay.
You have to get their consent, of course, because some of them might have to
Right.
tell their employers that they're an applicant in another place. Right now, they're protected from that disclosure. But yeah, you could call a special meeting, you could have it at a regular meeting, anytime. Anytime, do it.
So I think the clarification is if we move in that direction to have in-person interviews with those two people, we can't simultaneously be looking to restructure the position that they have been offered.
Right, I agree.
You said it
Well, I
far
was
more
just,
succinctly than I
yeah,
did.
no,
Thank you.
I was just looking for a step someone
So-
takes to
And my
to
next question
reposition
would
that.
be, if we choose to not interview these applicants, what is the process for that aspect? Is
Move
there
on.
a process? Just move on?
Move on, send
We
out,
would revise the position and then we would repost, and if
Yes.
they wanted to reapply, they would reapply.
But
But
even
if that
prior
were
to
the
that.
case, those applicants, that position will be null and void, it's no
Yeah,
longer on the table.
even prior to that, as far as notification of the applicants and things like that, is there a process for that?
oh,
as well?
send them acknowledgement letters, you've received their application, and at this time, you're going in a different direction or something.
Okay.
Extend,
There is a-
extend that courtesy to them,
Yeah,
of course.
absolutely, okay.
Okay, does anybody have anything else? We're down to topics not reasonably anticipated.
I have nothing.
I have nothing as well.
Okay,
Thank you all.
so at this point in time, I will accept a motion to close our meeting.
I will make that motion.
Second?
Okay, motion Matt, second Lisa. Any discussion? Hearing none, all in favor say aye.
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 Aye. Okay, so that's unanimous. So that closes out our Board of Health meeting for the town of East Bridgewater, Thursday, August 19th. Thank you, everybody.